Welcome to Pelvic Track. Pelvic Track is designed to help anyone suffering with pelvic pain, sexual dysfunction, urinary or bowel problems learn the successful tips and exercises to heal pelvic floor dysfunction. My name is Evelyn Hecht, pelvic physical therapist and owner of EMH Physical Therapy in New York City. For over 18 years, I have provided pelvic education, manual therapies, biofeedback training, visceral mobilization, and taught many exercises to heal thousands of men and women suffering from pelvic floor dysfunction. I teamed up with Calpesh Ventures, a software company, so we designed Pelvic Track to help patients and therapists learn more about pelvic floor dysfunction and how best to heal. I lecture extensively around the country promoting pelvic physical therapy to urologists, gastroenterologists, OBGYNs, midwives, sex educators, and nurse practitioners. I also designed the first pelvic health curriculum at two prominent New York universities, and it's still being used today. Pelvic Track has over 50 well-photographed and easy-to-read exercises. The symptom tracking aspect allows you to input each of your symptoms, rate the level of discomfort or pain, and then over time, re-rate this again and hopefully see improvements as you are being treated by a pelvic physical therapist and are doing your home exercises. We also include a reminder tool to allow you to program in your phone 4 or 5 times a day to signal a reminder to do an exercise or a breath technique. Our maps page is to allow you to find a pelvic physical therapist in your area and will be upgraded and updated on a regular basis. Pelvic Track has a separate membership for the pelvic physical therapists. It has a user-friendly dashboard so you can implement all your patient's symptoms. You can keep track of all the exercises as well as choose the exercises for your patients and measure over time the improvements your patients make. Your pelvic physical therapy practice will also be listed on the maps so patients can easily find you. So what is pelvic floor dysfunction? It's defined as the disruption of sexual, urinary, and bowel function with or without pain. And pain could be in the pelvic floor, the lower abdominal region, the hips, the lower back, the inner thighs. Symptoms for men can include erectile dysfunction, pain with ejaculation, testicular or penile pain, inability to sit, constipation, chronic prostatitis, incontinence following prostatectomy, and rectal pain. Symptoms for women can include painful intercourse, whether during or post-intercourse, urinary urgency, bladder pain, pelvic pain, C-section or episiotomy, or pain at the scar of an abdominal or gynecological surgery, as well as constipation and rectal pain. Symptoms for children can include urinary or fecal leakage, the inability to recognize their body's signals for when to void, and/or constipation. So let's review a little bit about the anatomy and why this can create all these symptoms. So here is a model of a female pelvis. The white aspect here is bone. This is the front of the pelvis. I'm going to show you inside. You can see it has a bowl shape ring, pelvic ring, and this is the back of the pelvis, the sacrum, and leading down to the coccyx. And I'll just turn this around so you can easily see. Here's the sacrum, here's the coccyx, and here are some of the muscles attaching onto the sacrum and coccyx region on the bottom. If I turn this around, I will show you the inside area of the pelvic bowl. The bottom of the bowl is considered the pelvic floor muscles. Levator ani, coccygeus, obturator internus, and they all sit inside, about an inch inside the pelvis from exterior, attaching from the front of the pubic bone and sweeping towards the back to the sacrum coccyx region. In women, there are 3 openings. The first, just behind the pubic area, is the urethral opening to allow urine to pass. The second is the vaginal opening for intercourse and birth. And the third is a rectum for defecation. In men, there are 2 openings. It's a much more narrow pelvis. Again, you see the sweep of the muscles from the front of the pubic bone, sweeping back to the coccyx. And here is the urethral opening for men, and just behind that is the rectal opening. So the pelvic floor muscles has 4 to 5 different functions. The first is that it's supportive. So if you can visualize, here is a pelvic ring, and here inside are all the organs, the visceral organs, the bladder. In men, you have the bladder, the prostate, and the colon. In women, you have the bladder, the uterus, and the colon rectal region as well. So these muscles on the bottom have to support the viscera. If they become dysfunctional, then there is a prolapsing or lowering of these visceral organs. The second function of the pelvic floor is that they are called sphincteric, especially around the urethral and the rectal region. Sphincteric means that there are small, basically little closures of the urethral and the rectal opening to prevent leakage. The muscles and the sphincter should be able to completely open when there is a need to void, and the muscles should be able to stay closed to prevent leakage. Another aspect of the pelvic floor is that these lower muscles also work with the deep front abdominal region. It's called the transverse abdominis, and other deep lower back extensor muscles. They work concurrently to preset or to stabilize your body before you move. And if there's any disruption within these core muscles, then the larger hip flexors, the larger buttock muscles will start to pull abnormally on your body and create some pain. So the pelvic floor is a core stabilizer as well. Anytime you have a disruption of core, of the pelvic floor, you can have pain, leakage, constipation, and any of the symptoms that I've mentioned before. If you have not seen a medical professional for your symptoms, please do not use a pelvic track as or in lieu of medical advice. I urge you to see a physician who can take care and diagnose to see if there's any medical causes to your symptoms. If you have already seen a physician and they cannot find a medical cause and the medications given to you have not made any changes in your symptoms, then the second step you would need to do is to locate a pelvic physical therapist, which you can find in our MAPS section. Your pelvic physical therapist can assess for restricted muscles and fascia. They can assess for trigger points, and they can provide manual therapies and exercise instructions and awareness techniques to help you heal. In most of our 50 United States, most states have what's called a direct access. So there may not need to be a need to find a doctor first for your assessment. You can go directly to a licensed physical therapist who specializes in pelvic floor and have them evaluate and treat you for a number of times. Most pelvic physical therapists know the importance of working within a team of medical providers, so they would certainly refer you to a doctor and other health professionals that can help you. I hope you have enjoyed learning about the pelvic track. I wish you the best in success in finding a good pelvic physical therapist and to utilize this app to help improve your symptoms and heal from pelvic pain and pelvic floor dysfunction. Thank you very much.